Hi everyone, welcome to the TPP Learning Academy. In this video we're going to look at the SystmOne Care Home module. We will look at two types of module which can be used for care homes, the first being SystmOne Care Home and the second being the adapted version SystmOne Mobile Working. SystmOne Care Home has all the functionality of a full SystmOne product, including, but not limited to, a full shared medical history. In this example, we can see the patient's demographic details, including patient picture and patient status markers showing the patient's chronic diseases. Importantly, using the tab Journal, we can see the information that has been recorded about the patient at the care home. But we can also switch the tab Journal to show GP data, and this will show us consultations which were recorded at the patient's surgery. Other areas of the patient record can be explored by searching through the clinical tree. Key areas include the patient's repeat templates, the patient's sensitivities and allergies, and the patient's recent pathology results, including detailed recordings of numeric values. Users with the correct access rights can supply a patient group direction or PGD to the patient, allowing a level of prescribing at the care home. Picking the type of PGD, this one is for pain management, and then filling in the duration and any notes, the user could supply the requested medication to the patient. Patient-specific warnings will show, which will make allergies, precautions and contraindications known to the prescriber before they continue to administer. A user can request a repeat medication from the patient's GP. Once the user has pressed the Request Repeat button, they can select which organisation they require the medication from, then select the drug required. The process can be repeated for multiple medication requests. A task will be sent through to the patient's GP when the patient record is saved. There are also many clinical tools which would be useful to the care home, such as the QRisk2 and FRAX calculators. SystmOne also supports the creation and writing of letters using integrated Word functionality. From the patient record, a user can choose who they want to send the letter to. They can select the template required. And this will merge the Word letter template with the patient record. We have the option to save the letter for future editing, save it as a finalized version, or email the letter to a recipient. Saving the letter will return you back to the patient record, where you can then view the letter in the patient record. SystmOne supports the use of care plan functionality. Here we can see that Mr. Smith is on several care plans, one of which is the long-term conditions care plan. If I perform the care plan, I can see the list of instructions required and complete accordingly. We can then see the completed care plan in the patient record. We also include Caseload Management functionality as part of the SystmOne Care Home module. Caseloads can be configured locally and linked to patient referrals, essentially allowing a team to look after the care home resident. In the example here, we have two locations, north and south, with patients attributed to each location. Staff at the care home can easily see residents on their caseload and retrieve the record from here. Staff at the care home have the ability to use the inbuilt messaging within the module. Here we can see how to send a message to the patient's GP. The task message automatically picks up the patient's registered GP, but the message can be sent to anyone at the surgery, including individuals or groups. we can write our message in the task body window and also attach any documents or letters relevant to the patient. Clicking on OK and saving the patient record will send the task message. If Caseloads is not the functionality that you're looking for, then SystmOne also offers a full bed management system with ward, room or location views. In this instance, we can see that we have 4 locations called Lillywhite, Oak, the Mews and Willow. By selecting the Oak, we can see the residents in each room. Users can easily switch between different locations, seeing which residents are in which location. SystmOne also offers full appointment and visit functionality, which could, as an example, be configured for in-house ward rounds or temporary home care visits. SystmOne Care Home also comes with a full suite of reporting and audit functionality, allowing users to build their own clinical reports or make use of the inbuilt reporting available. Users with the correct access rights can also use the audit functionality at both a user and patient level. SystmOne also offers a suite of decision support tools, including data entry templates and questionnaires, and from the workflow support where we can create protocols and automatic consultations. Before we move on to looking at the mobile working solution, there are a few points I'd like to make. The main client needs to be installed at any NHS organisation, which can include the care home itself, a local friendly GP, the CSU, CCG or at trust level. The users with access to the main client will do all of the configuration for the unit, for example, setting up staff members, configuring templates and building locations and appointment rotas, etc. Once all users have been added to the main client, they will then be able to log on to either the main SystmOne client or the adapted version of SystmOne solution at the care home, which has been streamlined to give them the functionality they need. Most care homes only require access to the patient record. The care home will have to follow the normal sharing policy of getting permission to view the record from the patient. Okay, so let's have a look at SystmOne Mobile Working then. SystmOne Mobile Working has been adapted so that it'll work on a desktop PC, a laptop or tablet with touchscreen capability. The idea is that it is a mobile solution that can be easily taken to the resident's or patient's location. We can see from the desktop that I can access a patient's record, check any task messages that have been sent to me, look at my forthcoming appointments or visits, and also download a caseload of patients or register a new patient. The biggest advantage to care homes is around medication. This is something that the care homes deal with on a day-to-day basis and have to request medication from the GP. Access to the patient record will make this so much easier and will provide great benefits and save time. I'm going to search for our patient, Alan Smith. I can do this by name, NHS number or date of birth. Selecting him will open the record. On the patient's homepage, we can see any reminders that Mr. Smith might have, all of the patient's allergies and drug sensitivities, along with the patient's previous consultations. To navigate around the record, we simply use the buttons on the side of the screen. Firstly, I'm going to select the Patient Record button. Here, the user can view the patient's allergies and sensitivities, medication, and repeat templates. Clicking on Repeat Templates will show the user when the repeats were last issued. To request the repeat medication from the GP, a user can simply click onto the Repeat Template button, select the items that the patient requires, and then press the Request button. On clicking Yes, a task will be sent through to the patient's GP. If I want to see any of the patient's letters, such as discharge letters or referrals, I can navigate to the Communications button. Clicking on the View button will open the letter, allowing me to view the content. Another advantage of the Care Home module is for a user to be able to see the patient or resident's recent pathology results. By pressing the Pathology button, the user will be taken to a screen where they can see all of the patient's or resident's pathology results by scrolling down the list. From the report, we can see the doctor's filing comments. We can see the results with the numeric recorded and the normal range. And finally, a button which will graph the previous readings for the user to be able to analyse trends. There are many more useful areas in the mobile working solution, all of which can be reached from the button menu. One of which is tasks and having the ability to send a new task to the patient's GP practice. Another useful area is the Vaccination Screen, where you'll be able to see those vitally important influenza, pneumococcal and shingles vaccinations. As you can see, the adapted version is mobile, versatile and fits in nicely with the functions that most care homes wish to use. I hope you found this video useful and informative. If you would like further information or to book a demo, please contact our accounts team. They'll be more than happy to help arrange this.